Hello, this is Angelia, and you are listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to try and help you figure out a little bit more about why you do what you do. And last time we were talking about motor development, and today we're going to pick up on rough and tumble play. As parents, we don't always care for that, especially if we're, protective or even overprotective. But it's just a natural part of childhood. About 10% of school children's free play at recess in the early grades, and that's if your school has recess. All of them should, some don't anymore. Consists of rough and tumble play. Vigorous play involving wrestling, hitting, and chasing, often accompanied by laughing and screaming. Now, I intervened in my oldest son's third grade class because that teacher was a male. He was letting them wrestle. And I'm not talking about, just wrestling around on the ground. I'm talking about wrestling moves where one kid came up and slammed another kid down on the ground hard enough, he got a concussion. So, yeah, I went to the school and talked to this teacher and said, not okay. And he said, well, yeah, he didn't think it was that big a deal. And I'm like, what? Okay, buddy, you probably don't need to be a teacher, but that's a whole other thing. Vigorous play that involves wrestling, kicking, tumbling, grappling, and sometimes chasing, often accompanied by laughing and screaming. This kind of play peaks in middle childhood. The proportion typically drops to about 5% at age 11, about the same as in early childhood. This kind of play reminds us of our evolutionary heritage. Unlike symbolic play, which is distinctly human, rough and tumble play was first described in monkeys. And if you notice little animal cubs and babies, that's how they play with each other. They'll bite each other and roll around, and they think that's perfectly okay fun. It also seems to be universal, since it takes place from early childhood through adolescence in such diverse places as India, Mexico, Okinawa, Africa, the Philippines, Great Britain, and the United States. So it's a thing all kids do. Motor development in middle childhood. At age 6, girls are superior in movement accuracy. Boys are superior in forceful, less complex acts. Skipping is possible. Children can throw with proper weight shift and step. At age 7, one-footed balancing without looking becomes possible. Children can walk 2-inch wide balance beams. Children can hop and jump accurately into small squares. Children can execute accurate jumping jack exercise. Some of us. Some of us never can. At age 8, children have 12-pound pressure on grip strength. Number of games participated in by both sexes is greater at this age. Children can engage in alternate rhythm hopping, such as 2-2-2-3 or 3-3 pattern, if you're going to do some double dutch and stuff like that. Girls can throw a small ball 40 feet. At age 9, boys can run 16.5 feet per second. That's in general, certainly not all of them. Boys can throw a small ball 70 feet. By age 10, children can judge and intercept pathways with small balls thrown from a distance. Girls can run 17 feet per second. And by age 11, standing broad jump of 5 feet is possible for boys, 6 inches less for girls. And that usually has to do with our build. The boys have leaner hip to thigh because we're built to have babies. So we have a wider, and that takes away some of that muscular straight structure that enables guys to run faster and jump further, because we give that up to have babies. Anthropologists suggest that rough and tumble play evolved to provide practice and skills used for fighting and hunting. Today it serves other purposes, alongside from physical exercise. Rough and tumble play helps children jockey for dominance in the peer group. by assessing their own and each other's strengths. Boys around the world engage in rough and tumble play more than girls do, a fact generally attributed to a combination of hormonal differences and socialization, because girls are raised to get along and be nice. Boys, not necessarily. Sometimes they're actually raised to be dominant, and so that's a difference, and not always a good one sometimes. Physical fitness. Although most U.S. school children get enough exercise to meet national goals, many children are not as active as they should be and could be. Among a nationally representative sample of 8 through 16-year-olds examined between 88 and 94, 80% said they play or exercise vigorously, enough to work up a sweat or breathe hard, at least 3 times a week outside of physical education. However, 15% of boys and 20% of girls did not meet the standard. So that's a small chunk, if we put that together, just call it a fifth. And that was, at the end of that study was 1998. So I imagine between the end of that study and nowadays, it's an even bigger number. Exercise, or lack of it, affects both physical and mental health. It improves strength and endurance, helps build healthy bones and muscles, helps control weight, reduces anxiety and stress, and increases self-confidence. So you should get some kind of exercise, 15 to 30 minutes and more if you're able, a day. And it's going to help you in all your ways, because your body likes to do it. You don't think it does, but it does. Even moderate physical activity has health benefits if done regularly for at least 30 minutes on most and preferably all days of the week. Now, there's different schools of thought on that. Some people say every other day. Some people say every day. Honestly, your physicality is going to determine what that is. I can do like 15 minutes, before the joints and bones hurt so much. I'm like, I can't go any further. There's people who can work out for hours a day, and have no problem with it. So your physicality is going to pretty much dictate how you're going to be able to do on that. But like in 2004, I was in a wheelchair a lot of the time because I had a back injury, and I wasn't able to have surgery, and so I laid for my 6 weeks, but the back still hurt. And so being in the wheelchair was not working for me because the person I was with at the time was not very compassionate and did not want to push me in the chair, and it was not good. So I started exercising because I hadn't exercised at all for like 6 weeks, and I just fell apart. So I started like 1 minute a day, then next 2 minutes, 3 minutes, and worked my way up. So if you haven't been exercising, and that's something that you need to do, and everybody needs to do that. Excuse me, itching my back here like a bear. Start out 1 minute and work up as far as you can go. There'll be a point and you'll know this is it, as far as I can go. And that's okay, because not everybody's the same, and that's okay too. A sedentary lifestyle that carries over into adulthood may result in obesity, which increased risk of diabetes, heart disease, and cancer. And I saw this one quack, I call her quack, I'm okay with it, who said that I was sedentary, but it's like, no, I used to roller skate, ride my bike, walk around the neighborhoods. I'm definitely not sedentary. I do still exercise every day. So you don't know what you're talking about. Yes, I gained a lot of weight when I was having kids. And no, I cannot exercise enough to take that off in a timely manner. So, yes, I'm a chubby person. Or it could be like Fluffy and say, I'm Fluffy. But I'm not super fluffy, and I do work out. So, if you're going to accuse me of sitting on my booty all day, I don't. Whatever. Let's see. Unfortunately, most physical activities in and out of school are team and competitive sports and games aimed at the fittest and most athletic children, like Anne Bancroft. Too often, parents and coaches pressure children to practice long hours, focus on winning rather than playing the game, criticize children's skills, or offer bribes to make them do well. And my son wanted to play soccer, and he played up into college level, and still, on just teams at different places, leagues. So he enjoyed the game. We didn't pressure him. We didn't, do any negative anything with him. He got his leg hurt. There was this big guy in a game that just kicked the crap out of him. And he had a bone bruise. And the emergency room doctor started yelling at us, saying, I hate you parents that force your children to play sports, and, look what you're doing to his body. And, we were kind of taken aback because we don't force anybody to do anything. So, but I have heard parents, like I said, there was this one kid, big guy. He come at my kid and hit my kid, and his dad's like, yeah, do that again. I said, that's my kid. He's like, so? I said, so? Don't you be telling your big kid to be knocking my little skinny kid down. That's not cool. And people was like looking around like, oh. Because like, yeah, you big dudes, you might be pretty tough, but there's mama bears out there that really don't care how tough you are, We will just scratch chunks out of you like you wouldn't believe. It don't even matter. You might win in the end, but you gonna know you come at our babies. You gonna know we had a altercation. These tactics that criticize children's skills discourage rather than encourage participation. So if you're mean to your kid and you're saying you need to do better work, eventually they're probably going to quit. They might stay in for a while and feel bad because they're quitting, because they feel like they're disappointing you. But doing that, sitting on them like that, and criticizing them like that, it makes it not fun for them. They're playing because it was fun for them in the beginning. And if you keep that up, they're gonna stop because it's no longer fun. Furthermore, most children will drop these activities after leaving school, and that's true. Like I said, my son played up into college. He played on some leagues at different places, and I don't think he's playing on anything right now. And they do have adult leagues here and there, but enjoy it. Let it be fun for them. If you're letting them play sports, let it be fun for them. Don't make it all about you, because it's not about you. If you had failures and didn't, do as well as you felt like you should have, don't put that on your kid and try to make your kid, be the best, blah, 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 and be so competitive and everything, because that's nuts. To help children improve their motor skills, organized athletic programs should offer the chance to try a variety of sports. Should gear coaching to building skills rather than winning games, and should include as many children as possible rather than concentrating on a few star athletes. And this is where, community sports comes in. Local communities will have these things. And, there was some handicapped kids, some mentally challenged kids on different teams. And that's how it should be. Everyone should get a chance to play. Everyone, should be encouraged. And in one of my older son's little leagues, the lady found out he had a mental disability, and she was upset that we didn't tell her that up front. How is she supposed to handle this? I'm like, just do like we do, every day. It's not a problem. Just, encourage him and let him play like you should. you Let's see, I gotta deal with this pop-up here. Hold on a second. Okay. Oh, man. I don't know why this thing decided all of a sudden had to update everything. Look at this. It's annoying. I know you can't see it, but you can hear it, popping in. Let's see. Programs should include a variety of sports that can be part of a lifetime fitness regimen, such as tennis, bowling, running, swimming, golf, and skating. And of course, schools don't have all of these things. I went to a middle school that has tennis courts. I'm a mom, and I went over there one time, played some tennis. Bowling, of course, it's a rare high school that has bowling. Running, most schools do have a track. Swimming, of course, I only know of one school around here that actually has a swimming pool anymore. There were a few more, but then they closed them. So, golf, there's a few of those. And skating, no. not anywhere around my area. Health and safety. The development of vaccines for major childhood illnesses has made middle childhood a relatively safe time of life, especially in developed countries. Since immunizations are required for school admission in the United States, children this age are likely to be protected. The death rate in these years is the lowest in the lifespan. Still, some children suffer from acute or chronic medical conditions, and some are injured in accidents. As children's experience with illness increases, so does their cognitive understanding of the causes of health and illness and of how people can promote their own health. Which you should. If you're mentally healthy, you will, so that you can survive. If you're not mentally healthy, you might engage in self-destructive behaviors that, put your health at risk. Children's understanding of illness. From a Piagetian perspective, children's understanding of health and illness is tied to cognitive development. As they mature, their explanations for disease change. Before middle childhood, children are egocentric. They tend to believe that illness is magically produced by human actions, often their own. I was a bad boy, so now I feel bad. Later, they explain all diseases, only a little less magically, as the doing of all-powerful germs. The only protection is a variety of superstitious behaviors to ward them off. Watch out for germs, a child may say. As children approach adolescence, they see that there can be multiple causes of disease, that contact with germs does not automatically lead to illness, and that people can do much to keep healthy. Children's understanding of AIDS increases with age, like their understanding of colds and cancer. But they understand the cause of colds earlier than they do the causes of the other two illnesses, probably because they are more familiar with colds. Although most 6 and 7-year-olds have heard of HIV/AIDS, misconceptions about its causes and symptoms persist. Among 231 African American children, ages 6 through 11, those whose mothers were infected showed fewer misconceptions than their peers. Misconceptions about the disease can be harmful, because children who harbor them are likely to avoid contact with classmates with AIDS. And you can't get it just by touching people or breathing their breath, I think most people know this, but, Interviews with 361 children in kindergarten through 6th grade found that children often give superficially correct explanations but lack real understanding of the processes involved in AIDS. For example, although 96 children mentioned drug use as a cause, most did not seem to realize that the disease is spread through blood adhering to a needle shared by the drug users. One 2nd grader gave this version of how someone gets AIDS. Well, by doing drugs and something like that, by going by a drug dealer who has AIDS, well, you go by a person who's a drug dealer and you might catch the AIDS from them by standing near them. So, yeah. From a young child's point of view, such a statement may be a logical extension of the belief that germs cause disease. This child may wrongly assume that AIDS can be caught, as colds are, from sharing cups and utensils, from being near someone who is coughing or sneezing, or from hugging and kissing. One AIDS education program sought to replace such intuitive theories with scientifically grounded ones and to test Piaget's idea that if children have not mastered a concept, they are probably not yet ready to do so. The developers of the program hypothesized that what young children lack is knowledge about the disease, not the ability to think about it. A carefully scripted program was tried on 306 third, 5th, and 7th graders in Catholic schools in Tucson. Trained health instructors conducted 2 50-minute sessions consisting of lectures, video clips, drawings, and discussion, and using vocabulary appropriate for 3rd graders. The curriculum emphasized that there are only a few ways to get AIDS, and that normal contact with infected people is not one of them. Experimental and control groups were tested before the program began, and again about 2 weeks afterwards. Students who had received instruction knew more about AIDS and its causes than those who had not, were no more and no less worried about it than before, and were more willing to be with people with AIDS. Almost a year later, the gains generally were retained. The success of this program shows that, contrary to Piaget, even relatively young children can grasp complex scientific concepts about disease if teaching is geared to their level of understanding. Medical problems. Illness in middle childhood tends to be brief. Acute medical conditions are illnesses that last a short time. Occasional short-term conditions, my goodness, such as infections, allergies, and warts are common. 6 or 7 bouts a year with colds, flu, or viruses are typical at this age, as germs pass among children at school or at play. Upper respiratory illnesses, sore throats, strep throats, and ear infections decrease with age, but acne, headaches, and transitory emotional disturbances increase as children approach puberty. So, some of us keep those allergies and illnesses into older days. Just depends on what you're allergic to and how bad it is. According to a nationwide survey of 30,032 families, an estimated 18% of children under age 18 in my goodness, 1994 had chronic medical conditions, an illness or impairment that persists for at least 3 months. Physical, developmental, behavioral, and or emotional conditions requiring special health services. Children with special health needs spend 3 times as many days sick in bed and miss school 3 times as often as other children. And those living with a single parent are more likely than other children to have chronic conditions and to face barriers to health care. And why is that? Because they are getting less antibodies, and they are more attached to the parent, and the parent is more attached to them, giving them a little more leadway in the sick days. Children with chronic conditions tend to be remarkably resilient. Most do not show problems in mental health, behavior, or schooling. Excuse me. Still, certain conditions such as vision and hearing problems, asthma, and AIDS can greatly affect everyday living. Excuse me. And yes, it can. They're for a good few weeks. I couldn't do much of anything because I was coughing so much. I couldn't even get on here and talk or anything. Vision and hearing problems. Most school-age children have keener vision than when they were younger. Children under 6 years old tend to be farsighted. By age 6, vision typically is more acute. And because the two eyes are better coordinated, they can focus better. So, you might think your kid sees fine, and then when he gets in school, he starts to have a problem reading the board or something like that. So that's when a lot of kids figure out they need glasses. Almost 13% of children under 18 are estimated to be blind or to have impaired vision. Vision problems are reported more often for white and Latino children than for African Americans. About 15% of 6 to 19-year-olds, mostly boys, have some hearing loss. Current screening guidelines may miss many children with very high frequency impairments. This is of concern since even slight hearing loss can affect communication, behavior, and social relationships. And they even now are showing how hearing loss can actually speed up dementia and Alzheimer's in people. So, get your hearing fixed. That's important. Asthma, chronic respiratory disease, is the number one cause of childhood disability, affecting an estimated 1.4% of U.S. children. Its prevalence has increased 232% since 1969. Apparently allergy-based, it is characterized by sudden attacks of coughing, wheezing, and difficulty in breathing. And it can be fatal. I got an inhaler right in there. Got my rescue inhaler. Children's asthma death rates have tripled since 1984, but the number of deaths fell nearly 20% in 1997 compared with the year before, probably due to improved diagnosis and treatment. The cause of the asthma explosion is unknown. A lot of people think it's pollution, plain and simple. But some experts point to more tightly insulated houses that permit less air circulation and early exposure to environmental toxins and allergens. Tobacco smoke in the home, use of a gas stove for heat, and allergies to household pets are important risk factors. Psychosocial factors also may play a part. Infants with family histories of asthma whose mothers were rated by clinicians as likely to have parenting difficulties tended to develop asthma by ages 6 to 8 because the parents just weren't keeping up with it. Poor minority children, especially boys, are most likely to be affected, perhaps because of inadequate access to health care. Our children in single-parent families, age of 10 days of school each year, and experience 20 days of limited activity, almost twice as often as children with other chronic ailments. Let's see. Some of the sickness may be avoidable. Most children with moderate to severe asthma do not get adequate treatment. I didn't have, an inhaler when I was younger. Now, when I was getting older, my doctor said, try Primatene Mist, and then when I got even older, they said, we're going to get you a rescue inhaler because my lungs just kept filling up, and they would give me, the Mucinex, was the last thing they gave me, and all kinds of other drugs that supposedly would clear me out. But I was having problems breathing, you know. And so they said, we're going to give you the real inhaler because that's just, kind of a temporary fix. So I got a big one now. And that's where I'm going to leave you today. And hopefully this helped you maybe learn a little bit more about why you do what you do. Until next time.